what we have here today is the flow of the webinar, and we really do want to make it an interactive session. We know that a lot of people in the audience also have their own experiences, so we're going to be having experience sharing from the different partners. We're really lucky to have Adelina Kamal with us from the AHA Centre to also reflect on what we're hearing in this discussion and share her opinions and experiences. And we'll also open the floor to question and answer, and we know, again, many of you have experiences and are dealing as well in this new normal. So a chance for you to be able to share experiences and ask questions. So yes, please do actively participate in our discussion today. Okay, so before we get started straight into the flow, I want to hand over to one of our panelists today, Jermaine, who will be from Oxfam, who will be sharing a bit about the ADMIA Partnership Group. Yes, over to you, Jermaine.
Hi, everyone. Good morning. And just to introduce APG, for some of you who might not be familiar, ADMIR Partnership Group, or APG, is a network of NGOs working with the ASEAN Committee on Disaster Management, the AHA Center, and the ASEAN Secretariat to ensure people-centered implementation of ADMIR, or what we call the ASEAN Agreement on Disaster Management and Emergency Response. We also work closely with and connect with different local and national actors and NGOs from different countries. And as you can see, our vision and our goal is really to focus on vision is to focus on vulnerable groups in ASEAN are resilient through our work and making sure that there are regional and national policies and local action that support that. Our goal is that the Asian civil society organizations continue to work together and work with the different disaster management institutions through the use of through the ADMIR and different types of policies in place. Next slide, please. And just to show you, these are currently the members of APG. At the moment, Oxfam is lead and World Vision is the co-lead for this group of organizations. Next slide, please. And just to quickly share, these are four of the main objectives that APG is working on. The first one is on advocacy, ensuring that there's a strong regional CSO body to represent the interests of vulnerable groups. And this involves working with, again, with local organizations, local and national organizations, and acting as a counterpart to the work of ADMIR in terms of implementation, using the work of using our partnership as a strong mechanism. There's also a pool of technical expertise that we can harness to support that work. Partnerships, a lot of collaboration, a lot of networking, a lot of working with different agencies, and we're going to hear a lot of that as well during this webinar. And lastly, APG works really strongly on coordination, especially focusing on preparedness and response. So supporting regional CSO bodies in coordination with the AHA Center, the different disaster management agencies, making sure that there's strong interagency coordination and cooperation in emergency response through existing mechanisms and ad hoc solutions when needed. And yeah, if you have any questions, please do reach out to us, and we're happy to share with you what APG is. Thank you. Back to you, Kaya.
Thanks, Jermaine. So as I said, we've got a great lineup of speakers today, and so you can see them on the screen. We'll introduce as we go through, but we've just to let you know we've got Oxfam Plan, Help Age, Mercy Malaysia, the AHA Centre, Save the Children, and Code NGO with us today. So in for a good discussion. We'll go straight into it. And so if we can go to the next screen. Thanks. Wanted to ask Mr. Angelo Militino, or Anan, the Regional Preparedness and Response Specialist, within the region, it's been hit by a number of disasters on top of countries dealing with COVID. So if you can share from your perspective, what are some of the lessons that you've been learning and that which may affect your future planning as well? Thanks. Over to you, Anan.
Okay, so before I start my sharing, let me just briefly give information about Plan International. So our organization is responding to humanitarian needs brought about by COVID-19 in 15 countries in the Asia Pacific region. This is on top of the ongoing responses, for example, Bangladesh and Philippines. And like many other organizations, we also responded to several crises while COVID-19 is ongoing. So we have flooding in India, Nepal, Bangladesh, volcanic activity in Indonesia. And we think that the most significant recent ones would be the flooding in Vietnam and the typhoons in the Philippines. Regarding responding to disasters in the context of COVID-19, first is that we found that our disaster preparedness actions have been significant, so have been very helpful. So we have what we call the hotspot analysis, which we produce quarterly to help us anticipate potential disasters. And so, for example, we know that it's typhoon season in the Philippines and Vietnam, so we make sure that we are prepared for the next quarter. What are the preparedness actions that we need to take? And we do this regionally and globally so that we understand what the regional offices and the global offices need to prepare to support the country offices. So to some extent, we have anticipated the responses in Vietnam and the Philippines, and we did some preparedness actions. But of course, we are not a perfect organization, and we have faced a lot of challenges. But the preparedness actions have helped us a lot. Second point under one is the years of influencing. So years of influencing have a lot of advantages. No, it was easier for us to work with governments during the crisis to push for specific agenda for vulnerable communities. So, for example, in Bangladesh, the government has issued a directive to limit the access to refugee camps. So that made it is reducing the number of humanitarian workers at least by 80%. No? But nonetheless, because of our previous influencing efforts in these areas, case management services to protect children and youth has been considered a critical service. So which gave priority to humanitarian organizations that support that provide such kind of support. Third, maintaining relationships. So our existing networks and partnerships have helped make anticipatory actions. No? So structures would be different per country. So for example, in Vietnam, they don't have a humanitarian country team, but they have a strong government-led coordination mechanism. And the Philippines, we have the UNHCT, but also, of course, we have government agencies as counterpart. So nonetheless, despite these differences, these networks have helped generally make quicker actions and more efficient because of these established working groups. Another example is that in Bangladesh, UNFPA was quick to tap plan to help respond to the floods before the flood as part of anticipatory action. And this was made possible because of the relationship between UNFPA and plan. And also highlighting our coordination with the AHA Center with the Vietnam floods and the typhoons in the Philippines. So the AHA Center has helped broadcast the priority needs of communities and as well as the activities that humanitarian agencies are doing on the ground. So we give thanks to the AHA Center for that. Continued response. So the fourth picture then under number one is continued response. Plan was still in the response mode when the new disasters happen, new emergencies happen. So it wasn't a challenge for us to shift the mindset of staff from development to humanitarian because we are already doing a response. So it was easier for us because the system's already in place and the teams that were deployed already know the protocols and safety measures. So we have quicker deployment, quicker boots on the ground. So that helped us, respond to the new disasters. Second point, the response also responds to exacerbated humanitarian needs. So as we all know, COVID-19 has pushed poor families even poorer. Vulnerable groups became more vulnerable. And the response now considers this. For example, Plan International is less likely to do emergency response in areas that are regularly visited by disasters. for the fact that families and the government have already preparedness actions because of these are recurring events. No, but for this instance, food stocks, for example, of families in Vietnam that were affected by floods have already been consumed because of the lockdown for COVID-19. No, so because they don't have that kind of support, so plan provided food support to these communities. In the Philippines, cases of online exploitation of children has risen because of the pandemic, and in Bangladesh, girls have been engaged in child marriage. So we also did some advocacy and influencing efforts to help address these concerns. Third, we became creative in facilitating community engagement, and I think this is across the humanitarian sector, no? Because we understand that there is a limitation of people going to the ground to do face-to-face community engagement. So I'll just give you two examples of how we became creative, quote unquote. No, so for example, for Vietnam, we have the youth ambassadors from the communities where we have worked for years, and these youth ambassadors were the ones who sent us the videos of what is happening on the ground when at the start of the onset of the flooding. No, so they give us a picture of what's happening on the ground and what are the priority needs of the community and how it's going to shape the response. Similar to the Philippines, we have the youth reporters, which we have ongoing for a number of years now. And the youth reporters have helped us disseminate life-saving information through local radio stations, to mobile speakers, and through online platforms. And then lastly, so for number four, I'm giving emphasis to the cash assistance, which has been particularly helpful for the responses. And the icons I used there were from OCHA, so thanks to OCHA. But I'm just showing that the airports have been are not operational or operating at the minimum. So borders closed, ports closed, bridges, etc. So the companies, the service providers, which usually we run to buy products which become humanitarian aid, like for example hygiene kits and water kits, they operate on a skeleton or a minimum scale, or not at all. So it was a challenge. Sorry, I'm hearing echo. So if someone can mute. Uh, okay, so thank you for that. So it was possible to it was a challenge for us to do large scale procurement. So it was very helpful for us to do direct cash assistance to beneficiaries to address this, so they can buy in local markets and local stores, helping local economy, and also at the same time helped us adhere to COVID-19 protocols, because that meant lesser staff on the ground, lesser face-to-face engagement. And that's all from me. Thank you very much.
Thank you, Anand. Really interesting how being able to adapt and show the innovations of being agile. And I think the importance you've raised on disaster preparedness and how you're able to build on a lot of those existing relationships, existing policies and programs that you had in place before. I think this leads nicely into our next speaker, which is Mr. Jermaine Baltazar Baya from Oxfam International. As Anand was just sharing, COVID has forced us to be more innovative in terms of how we respond. And I'm wondering if you can share from Oxfam's perspective about some of the innovations and new partnerships that you've been doing to adapt to this new normal. Over to you, Jermaine.
Thank you, Kea. And yeah, that's a good question. And just to note that I'm sure many of us attending in this call had to be very creative in how to respond to COVID-19, and on top of the different disasters. New collaboration, new partnerships, and new ways of working. And what I'm going to share to you is how is Oxfam working with the private sector during the COVID-19 response and other emergencies. So we're also responding in a number of countries. But on top of that, we've seen in the last few months, there's a lot of cyclone in South Asia, and most recently floodings and typhoons in Southeast Asia. So that's really quite a complex situation we are in. And just to briefly share with you the experience of Oxfam with the private sector. So a quick snapshot of the different examples of private sector organizations that we are working with, and we're working with them in different modalities. So some of them might be providing funding support, like for example, Unilever, Visa, and Microsoft. So for Unilever, we're working with them in Nepal and in the Philippines on hygiene behavior, hygiene behavior change, ensure risk communication, and supporting, ensuring communities understand what COVID-19 is and are able to reduce the risk and mitigate the impact of that. So there's also companies that provide services. So I'm sure many of us do that, and there are groups that provide technical expertise. For example, Global Parametrics, which is well known in terms of climate modeling and doing some work supporting us in the anticipatory action programming that we are doing. And the last group that I'm quite familiar with are those strategic partners, private sector engagement that goes beyond just contractual agreement, but we co-develop programs. We think of ways to further enhance programming and really work together to make sure that humanitarian action is better. Next slide, please. Just to zero in on one of the experiences, I'm going to focus on the Philippines, where we are working with Paymaya. Paymaya is a mobile platform application that provides services in terms of mobile money, online transactions, and all these things. Initially, it was designed for urban. The target client for Paymaya was the urban population, the young urban professionals, as they say. But as a learning from our learning from Haiyan, we saw the need to co-develop and see how a digital platform can help ensure that we are quicker and faster and safer. So for the COVID-19 response, the team used a digital cash transfer mechanism through the provision of an electronic prepaid card. And this helped because it will reduce the virus transmission and manage safe and quick transparent cash transfer. So they don't have to line up. They don't have to stay and wait for the money to be given to them. They can just receive a text message saying that, oh, the money is there already in your account. And for using the money, you have a variety of options. You can just use it to purchase directly from the supermarket, or go to the bank to withdraw the money, or any other financial service providers. The money was around $100 and used to support food and medicines and different essential needs during the time. And one key feature of this product is that aside from just giving money, it was also offered a lot of financial services. So it contributed to making sure that people are part of the financial inclusion work, and they have access to a variety of financial services. And right now we're also looking at how it has evolved and really be part of the disaster preparedness. So we piloted a number of cases as part of the typhoon and even for the COVID-19 for anticipatory action. So making sure that people are well prepared for any shocks that may come. And the last engagement I think that we have with Paymaya is now they've also included Oxfam together with other organizations for fundraising. So as you can see in the photo, those who are interested to donate money to these organizations can easily go online and donate. So that's one platform as well that has evolved with this engagement. Next slide, please. So how was that experience? And I'm going to share with you a number of key learnings, both pre-COVID and during COVID, that probably can capture what's our experience like working with the private sector, and the use of new technologies. One, it's important to have partnerships that add value, not only for your organization but also for both parties, and that's important to sustain and to make sure that the relationship will last and be really really fruitful. The other point is on when you are thinking of new approaches. Sometimes we tend to say that okay, we need to invest on this, we need to invest on people, we need to invest on technical capacity. When in fact, there's also the option. If you're looking at new approaches, try to scan the horizon, look for new partnerships. There might be private sector, academe, technical experts or groups who have that necessary expertise and who can provide that instead of you investing. The third point is the importance of working with the ecosystem. You have to understand the existing system. Who are the agencies and the stakeholders involved? What are the infrastructure that is available? How is the people or the community, the end users using this technology? Or what are they using now? What's the situation like? That will help you understand, are you feeling a gap? Do you need to bring in something new? Or do you need to innovate? Or do you need to just improve an existing system? One thing is that this will help because of Paymaya having a platform already. This will ensure that even beyond the project's life or even Oxfam support, the system will work. The fourth important point is I'm sure many of us, when we are introducing new technology, are we thinking about inclusion? How about the elderly? How about the persons with disability? How are they going to make use of this new technology? Uh, what's our mitigation measures? What's our options? And if the new technology is not really possible, what's the option for them so that they will not be excluded in any support or any space for participation? So we need to think about that as well. And sometimes you need to make a decision. This is not applicable, so we have to use another method. uh, a platform for everyone. When we started building this work with Paymaya, around for the first year and a half, we're looking at it's Oxfam branded, but we felt that for a platform to evolve, to be appreciated by more people, to be utilized by more people, it has to be a platform that can be open to them. So we've removed the branding. We've said this is something that anyone can use. And in our experience, we've offered it to UN agencies who've used it. A number of INGOs have used it. A number of local organizations have used it. And we felt that that's our contribution. We don't need to have our name there. And we do hope that people make use of it. And this will help our humanitarian response, especially now in the time of COVID. And enhance humanitarian approach. We continue to think about how to make things better, how to thinking about the community, thinking about the affected community. How will it be more transparent for them? How will they be able to participate? How will they have an input to the work that we're doing? So we're communicating, we're engaging, we're asking them how is the experience, and all sorts of things. So hopefully this will further improve the work that we are doing. Safe programming. How do we make sure that whenever we work with the private sector or any organization for that matter, how do we make sure that we reduce the risk to communities, to staff, and to partners, and to everyone? And that should always be on top of our minds. And the last point that I'm going to share is on knowledge and learning. We continue to learn and improve. As I mentioned, we go back to the users. We ask the partners what works, what did not work, how can we improve the system, or how can we better make sure that it's appropriate and relevant to the communities we serve, and we build evidence so that if some organization or anyone who's interested to learn about it, we're very open to share and work with them. And yeah, that's it from me, Kaya. I hope I answered your question. Thanks.
Thanks, Javed. No, they really did it. And I think the breadth of private sector partnerships, not just as funders, these more innovative approaches, but this through line you had from learning from Haiyan to applying to the response and now thinking about anticipatory action for future and co-creation with communities and this learning by doing approach, I think something of real value in taking forward. We're now going to move on to Miss Dini Lynn Oncapo, the officer in charge and deputy executive director for Code NGO in the Philippines. Dini, as Code NGO is the largest coalition of NGOs in the Philippines working across that development humanitarian space, and you've had to deal with this multi-hazard environment that we're in. Can you share from your experience and of those of the members as well, how you've had to adapt to this changing environment and some of the lessons for that? Thanks. Over to you, Dini.
Yes, thank you, Kaya. Let me start with the first slide. Mafe, can you please show the first slide? By the way, I am right now with my colleague from the organization, Ms. Mafe Del Mundo, is with me right now in this forum. She's the program officer for membership, as well as officer in charge for coordinating with 10 regional CSO DRRM hubs that we have organized a few years ago. Mafe?
Can you allow me to share? One moment.
There, okay, thank you. Okay, I'd like to start our sharing with this slide. 6 months down the road, since Luzon was placed under enhanced community quarantine in March, we received a message from our Honorable Vice President Lenny Robredo, who gave recognition to the work of CSOs, of Code NGO, our members and our partners during this difficult time. Her recognition strengthens our resolve. And she reminded us very confidently, we are made for times like this. And so as we reflect on what we have done this 9 months, we at Code NGO says, yes, indeed, we are. Next slide, please, Mav. Okay. So when Luzon was placed under ECQ on March 15, majority of Code NGOs member networks, we activated them and asked them to also reactivate the regional DRRM CSO coordination hubs in 10 regions of the country. And the hub conveners, we met them regularly, something like weekly, I think, where in those meetings, we supported one another. We took the opportunity to share experiences that we saw happening at the local level. We discussed action steps and exchanged response efforts and good practices and started to coordinate. Next slide, please, ma'am. So there were many COVID-19 response initiatives that came out from our member networks and the coordination hubs. Some of them were coordination among and within the members. We built also partnerships. We conducted household level surveys, community assessments, did mapping work and planning. We also intensively did information and education campaigns and risk communication in the communities. Cash and food relief efforts for staff, member organizations, partner communities, and frontline health workers. Some of our member networks, one member network particularly, offered online psychosocial intervention for frontline workers and communities. We also monitored government interventions on COVID-19 and did fundraising activities. The photo that you're seeing right now in front of you is a snapshot of the many stories that we have published on a dedicated web page on our website. These are stories that came from the member networks and from the regional coordination hubs of what were happening at that time or during those months in the communities. No, so the dedicated web page is on our website www.codengo.org/COVID/. So we continue to document the stories still today. Next slide, please, Mafe. In relation to fundraising activities, 3 national member networks of Code NGO did extensive fundraising. For example, we've listed them there in front of you, so you can see. Member corporate foundations of the Association of Foundations, as well as the parent corporations of these foundations, have so far contributed around 3 billion pesos in their COVID-19 response. The Philippine Business for Social Progress, which is a coalition of companies or corporations, it was able to raise around 133 million pesos through a very creative fundraising activity called the Bayanihan Musikahan Project, which was an online concert that national artist for music Ryan Cayabyab led or organized, and he invited famous Filipino artists to perform during that period. So that project was helped raise 133 million pesos in cash and in kind for the projects of PBSP. Another national network, the Philippine Partnership for the Development of Human Resources in Rural Areas, was able to raise from external sources by their members and their partners an amount of 44 million pesos, which helped their partner communities. And then the other Code NGO Hub members in different regions of the country were able to mobilize an estimated amount of 7.9 million pesos in cash and in kind contributions and volunteering services to serve communities where they are located. Next slide, please, Matt. We did not only look outward, but it was really during this time, I think, that we gave value and importance to the work of the coalition, and we started taking extra care of our secretariat and the board. So the Code Secretariat had weekly sessions to assess the current situation in our families, in our own communities, at a very personal level, as well as the work that we are doing since the community quarantine was declared in March. In addition, the board, which meets quarterly for the past years, started meeting online on a monthly basis. So in these meetings, we exchange notes with each other, assess the impact of the pandemic and other emerging issues to our work, and how we could respond as a network and as individual networks, as a coalition and as individual networks. We also activated our calamity fund to support member networks during the crisis. The main objective of the calamity fund is to provide quick relief assistance to member networks or their members or their staff who were significantly affected by COVID-19. A total of about close to 200,000 pesos was successfully distributed to 32 staff of 8 member networks of Code NGO to augment their salaries or support their families during the lockdown. We also extended additional communication support to our member networks, so they could be assisted with regards to coordination and operations while everyone had restricted mobility during the early 5 months since the community quarantine was declared. And then we also organize capacity building seminars for our member networks to help them develop some skills relevant in the new normal, like how to facilitate online meetings and related topics. Next slide, please, Mav.
Just a couple more minutes, Dini. Thanks.
Yes. Okay. So last September, we celebrated our General Assembly and Social Development Week, and we focused on not so much on what the problems were, but on what solutions have communities found when they were coping with the pandemic. So we featured work of member networks who cared for carers and frontline workers through remote response on mental health and psychosocial support. The Social Development Week also valued the responsive leadership, innovation, and compassionate management that happened in various cooperatives around the country. And we also talked about promoting food security and multi-stakeholder collaboration. In the end, two major lessons that we learned from this public forum were, number one, we have that empowering mindset. The civil society sector is actually a source of many innovations during that time. And we may be limited with regards to financial resources, but our wealth lies in our social capital, the trust that the partner communities have on us. And trust building is our investment, and that support giving is really extensive in the communities. And then, so as next steps, we want to widen the conversation. We want to engage more sectors and organizations, because as communities draw strength from each other, we saw that innovations are born. Next slide, please, Mav. And then in our General Assembly, the members of Code NGO came up with two major resolutions. The first one is that Code NGO is to monitor, study, and address the effect of COVID-19 pandemic on CSOs in the Philippines, and to facilitate and innovate ways for its members to synergize strategies during these trying times. The second resolution calls us to deeply reflect and recalibrate our policies, programs, and projects so that we could stay relevant and pursue in the next immediate years as we start to recover and move towards a better normal. And then Code NGO is tasked to provide additional technical support to its members in enhancing its systems of internal governance, so that the systems are appropriate and agile for the needs of the new normal period. And lastly, so we end our sharing with this slide. Code NGO would like to see, of course, our country succeed in controlling the spread of the virus, in saving lives, and providing safety nets for the most vulnerable. But from within our capacities, we aim to support efforts of all stakeholders, from the local level to the national level. We aim to win over this crisis through peaceful, participatory, and empowering means. Thank you very much. That's all. Thank you very much.
Thanks very much, Dee. I think you said it well in the beginning of the slide, when it's like we were built for this, and recognizing the social capital, like you said, that you have, which is a huge asset, and taking that forward in your resolutions and strategic planning. At this point, we're really lucky and want to call on Adelina Kamal, the Executive Director of the AHA Centre, maybe just to share some of your reflections on, as we've heard this discussion so far, if you're seeing similar trends and also some of the adaptations that the AHA Centre has had to make in responding. Over to you, Adelina.
Sorry, I need to unmute myself. Can you hear me and see me?
Yes, perfectly. Thanks.
Okay. First of all, thank you very much, APG members, for inviting the AHA Center to participate in this webinar, and also the co-convener of the Humanitarian Partnership event, UN OCHA I just texted Vanda to reconfirm how old APG is, and she confirmed that the APG was born in 2009, when the ASEAN Committee on Disaster Management was about to start developing the ATME work program for 2010-2015, and that was over 10 years ago. APG, in fact, is older than AHA Center. AHA Center just commemorated our 9th anniversary. And since the beginning or the birth of AHA Center, we have been working closely with the APG. For example, in the ERAT deployment to Typhoon Haiyan in the Philippines, where the idea of One ASEAN One response was given birth, we had the support from APG, deploying some of your colleagues. Also in the training of the ASEAN Emergency Response and Assessment Team, ERAT, in the contingency planning, and so many others. So we would like to thank APG for the support so far, and we look forward to continue our collaboration with you. Second, I'd like to reiterate what Kea mentioned. But in addition, I would like to add some more key learnings generated from the talk, as well as from what I have observed in the past 1 year. There are 9 key learnings. One, of course, the local actors. Second, agility. Third, the collaborative nature that is required to go through this difficult time. Fourth, the fact that we need to consider additional layers of risk in our risk assessment. And that's what also we are trying to do in AHA Center under our monitoring system. Fifth, the fact that COVID-19 further exposed assessing vulnerabilities and gaps, and that we need to see. But I would like to add 4 more from what the other speakers have said. That is the use of digital platform and creative IT solution that could help promote inclusivity. Though at the same time, I also need to remind all of us to ensure that the digital platform and the creative IT solution will not actually widen further digital divide. We are coming from a region that is quite IT adaptive, so hopefully that will not be a problem in the future, but this is also something that we need to continue to look at. Number 7 will be knowledge and lessons. Asia Pacific, including Southeast Asia, is a region that has experienced world-class disasters, for more than 10 years. And therefore, it is important for us to reflect on that. And I like what Germany said, reflect from Typhoon experience, but also see how we can actually utilize the experience from responding to disasters in the midst of COVID-19. Number 8, safety first. And it's not only physical safety of our first responders, but also the mental health, the psychosocial support that we need to provide for our first responder. And that, I think, should not be underemphasized. We need to actually put that as a priority. And number 9, and this is coming from code, the fact that our region is resilient, that resources are not necessarily financial resources, but also other type of resources. And I think we need to capitalize on this further and make our region to become the model for other regions in the world. Now, since the theme of this webinar is about partnership, I need to mention about trust, because trust is really the product and outcome of continuous relationship and partnership building.
Oh, sorry, Adelina, we've just lost you.
Sorry?
We just lost you after trust building.
Okay, so I will mention again. Hello, Kea, can you hear me?
Yeah, perfect, thanks.
Can someone confirm that you can hear me?
Yes, we can hear you. I'll type
Yes,
it
we
in.
can hear you. I'll type.
Okay now.
Okay, so after that, so I'll mention again about trust, since the conference is about partnership, right? So I think we need to really focus on how we measure the product of our partnership, and the product of our partnership and relationship building is trust. And in times of crisis like COVID-19, you cannot search trust. You cannot begin the partnership in the hope of gaining trust in the heat of the moment. So you have to build the trust before you need it. And therefore, I think what we can learn from our experience in the past 1 year responding to COVID-19, and this is not only for AHA Center but for everyone in the humanitarian community, is whether we have built the trust enough so far. What has happened so far, the fact that, for example, AHA Center has been able to respond and provided support to the government of Vietnam and the Philippines, that also the result of the trust building that we have built over the years. Also, the relationship that we have built with the UN, OCHA, with the WFP, with the private sector in the Philippines, allowing the HL and UPS to help us, in the movement of the relief items. Or with the civil society sector. All of these are tested during COVID-19, but it was not actually built during COVID-19 or this year. It was actually built over years of trust building. Second, as disaster managers, we should have been able to adapt, better than the other sectors. So our ability to adapt and to remain agile is also tested during COVID-19. I would like to offer a formula that actually I didn't invent. I heard it from one of the webinars organized by the Humanitarian Partnership Group of ODI. And these are the 4 A's: anticipate, articulate, adapt, and accountable. And I think the first 3 have been quite prominent in the presentations before. Yeah, we need to be better anticipate. As disaster managers, we need to be more anticipatory than the others, right? We need to better articulate, and that relates to advocacy, that what Germany mentioned. We need to articulate, what we have built so far, so that the other actors will be able to convert, to what we believe, and that include anticipatory action to allow for early action. And we need to be more adaptive, agile, creative, and innovative, and accountable. I think accountability is also important, and there is a digital platform that we can utilize to ensure that we are more accountable. So anticipate, articulate, adapt, and accountable. And with the COVID-19, there is no turning back. Turning back. We cannot just have incremental steps, right? We need to have transformative adaptation, and I think the 4A formula will help us in this transformative adaptation. AHA Center just turned 9 years old last November, and our theme is transforming through uncertainty. And I think this is not only applicable to AHA Center, but every one of us, right? This is uncertain time, but we need to transform ourselves. We need to see whether our trust building efforts is something that we need to improve further. And if there is anything that we can improve, what will that be? Because there will be more challenges in the future. Now maybe COVID-19, but the future could be biodiversity collapse in view of the climate change. So I'll stop at that, and I look forward to listening to other presentation. Over to you, Kea.
Thanks so much, Adelina. You gave us a great, I think, roadmap already for starting our discussion of the way forward. And I really liked your comment on you can't surge trust, and that we have to be building. This has come a long time before in our action, not just at the time of COVID, and needing to focus on that, and our actions not needing to be transformative. I think that will really help us when we start to go into the Q&A and everything. I will ask if, as well, we have our colleague Thomas Howell as well from Save the Children, if there was anything you wanted to share at this point in reflecting on some of the discussion we've had so far.
Thanks, Kea. Yeah, and thanks to the 3 presenters for sharing those learnings, and Ibu Adelina for her insights. I think, Save the Children is working in 18 countries across Asia and 7 out of 10 ASEAN states. We've supported the COVID response, but also, we've been responding with governments and civil society to the typhoons and severe flooding that's happened across the Philippines, Vietnam, Laos, and Cambodia, and a number of other responses across Asia. So there's just been an incredible strain on the system and our collective ability to support families in need in 2020. I think just in terms of the presentations we've had, I just want to fully support the points made by Plan around preparedness. I think we really have seen in COVID-19 and in the recent responses during COVID-19 just how important strong in-country operations planning and partnerships are. And I couldn't agree more with the point made by Ibu Adelina around building trust, and I would really apply that to the partnerships function as well. I think perhaps one of the positives that's come out of COVID-19, in my opinion, from my perspective in Save the Children, is that it has helped us move forward some grand bargain commitments that we've made. And this has been highlighted by others, but just to restate those points, the more of our aid going through cash interventions and being delivered alongside and through local entities. I think both those things have really moved forward, and they were identified by Plan and Oxfam, and I just wanted to kind of restate those. I think I think most of us were already moving on that journey to try and do more on those two areas, but I think COVID-19 has really accelerated what was quite a slow journey. So in some ways, that's quite exciting, I believe. And in our responses, in the last quarter, cash has been the primary modality in all, and almost all, I think all, have involved implementation alongside or through a local entity, which is really exciting for Save the Children. I think just to flag that it was alluded to, but also to mention again that with the change in ecosystem of actors and stronger participation, if you like, from civil society, that coordination remains critical, and that we need to constantly evolve our ways of working to ensure our mechanisms align with that, and that the growing local civil society engagement is inclusive in the mechanisms that we're working in. We've seen that in Cambodia in our response there. Save the Children is the global education cluster lead, and I'm pleased that as part of this continuing process to adapt, we're currently with UNICEF delivering education coordination training for non-cluster countries across ASEAN, which includes civil society and Ministry of Education representatives, which is great. I think just the final point, because I know we're kind of struggling for time, Kea, is to say, looking forward, we know that coping capacity of families has been severely impacted by COVID-19, right? Save the Children's research shows that 88% of people are struggling to pay for food. Children are feeling more worried and less hopeful, and unfortunately, a majority of children have been out of school for a long period. So while economies will start to recover in 2021, it's also kind of clear that COVID-19 has undermined coping capacities. And so there is going to be a continuing need from organizations like ourselves, governments, civil society, to work across development and humanitarian and focus on building back that resiliency that's been lost. So yeah, those were a couple of my reflections from listening to those presentations. And yeah, look forward to hearing from the rest of the presenters. So back to you, Kea.
Thanks very much, Thomas. And in that short, you were able to put coordination, the nexus, and the grand bargain on the table. Really important discussions as well as we talk about the future of humanitarian. So thank you. We're going to, like I said, go straight into the next part of the presentations. We're going to go to Dr. Heng from Mercy Malaysia. Mercy Malaysia is an organisation not only operating obviously in Malaysia, but across the region, and a health service provider, one of the main activities. So if you could share with us, Dr. Heng, a bit about how Mercy Malaysia's had to adapt, both domestically and regionally, would be great. Over to you.
Thank you. Kea, can you hear me? All
Perfect. Clear? Thanks.
Good. Very good. Thank you so much. It's great to see all our old friends back together. It's been a long time. Now, this COVID has really affected the way that we work and the way that we think. I think to share with you one of the big things that actually happened in Malaysia, even in a national scenario is actually coordination, coordination, coordination. Never mind internationally. I will give you an example. In the first phase, in March of COVID, the big thing that went out was, yes, get ready for this. This is a bad respiratory disease. Yes, we will need ventilators and things like that. And every NGO started donating ventilators without a consultation with the Ministry of Health, how many was needed and where it would be. As a result, by the end of April, we had excess, over maybe 1,000 excess ventilators. So we had to tell people, please stop. Don't just donate. Donate what the Ministry of Health wants. I think coordination is very important. And if that doesn't happen, you're going to end up duplicating a lot of your donations. The second thing that we have learned also, in the national context, localization. Because working from Kuala Lumpur, you can only deal with Kuala Lumpur. But when every state and every village or big city outside Kuala Lumpur is affected, you need the local volunteers to be able to help out. You need them to be able to coordinate with headquarters. You need them to be able to communicate effectively with headquarters so that donations get through and also the work gets through. Never mind our international work, which is in Bangladesh and Philippines and Myanmar. In fact, we begin to realize then how important it was for us to actually empower the local people so that in our absence, they can actually carry on the work that has been there. So this is the kind of things that I would like to share with you. The other thing, which again was sometimes we overlook it, is the psychosocial part of it. Luckily, in Mercy Malaysia, we have a huge psychosocial department which has been in existence for a long, long time. But this is even more important now because the volunteers who are going out to provide the food, to do the swabbing, need to talk to the local population, to the locals there. In times like these, it's very important to be able to say the right thing, to say things that are comfortable, to say things that make the victims easier. Not only just to say things, but important thing is not to say certain things as well. So this training that we have now, which we put out to all our volunteers, is very important in this period so that they know how to be comforting to all those who are out there. People who don't have food, right, when we give them food packages, you must be able to say the right thing to them. Those who have relatives who are in hospital or locked up because of COVID or in quarantine, there are certain things that you must be able to say to them. So we started this huge training procedure for all our volunteers online so that they can actually get trained on the psychosocial bit. And then we have another one, which is online as well, which is run by all our psychosocial volunteers for people who are stressed and to be able to contact this particular number. Unfortunately, it's very much this problem with our society. People who are stressed or people who have emotional problems don't want to talk about it. Maybe it's a sign of weakness or whatever it is. and they keep it to themselves. And as a result of that, we have actually seen a huge rise in gender violence. We've also seen rises in suicides as well. And never mind gender violence, but you know, there are a lot of cases where divorces have happened. People have left home because of the stress and because of staying together and not being able to get out. And for this, we have reached out to the people. We have, you know, advertised this number that you can call. I must say that in the beginning, there were quite a few people, but as the numbers of people of infections go down, the calls are much less. But again, we have to be prepared, because by the time you have third wave, etc., you're going to have a lot more. So it's about anticipation. It's about preparation. So we thought that we were pretty well off by April or May. We thought that we were over it. And then suddenly the second wave came along, and it was a lot bigger than the first wave. And that really sort of, in a way, showed up how unprepared we were, actually. So now, having survived the second wave, we are actually getting prepared now more for the third wave. The other thing, of course, is that which we suffer is actually donor fatigue. In the first wave, there were lots of people wanting to donate and you know, wanting to help. But the numbers were very small. So we managed to ride through it quite well. And then when the second wave came about, when there were so many more people, we suddenly realized that the donors were not giving any more money. And we actually then had to be, you know, try harder and be more innovative to go around looking for more financing and other forms of financing and partnership. So, I mean, this has helped us learn a lot and open our minds. So that's all I have to say. Thank you very much.
Thank you very much, Dr. Heng. I think the importance of having to pivot your actions and recognizing, yeah, the need, like you said, I think for having that model from the national to, you know, the community level, and being able to provide that training capacity support for a really important need, which, like I said, is the care of the health workers as well themselves, and the psychosocial support. And this leads us quite nicely as well into Mr. Deepak Malik's presentation, which is going from HelpAge International, who this point has been highlighted and come through a number of the presentations about the risk that frontline workers are facing, and the need not only for psychosocial and for the care, for us to consider how do we provide that in this new normal, and wanting to see if you could share a bit about how HelpAge, who deals with some of the more vulnerable populations, has been adapting to that. Over to you,
Great,
Mr. Deepak.
thank you. Yeah, I think I would like to start with the piece Adelina had mentioned. Can you please go to the next slide? And I think when it occurred, when everything started in March, even I had a lot of travel plans, which I had to cancel and sit at home and start working from home. Things happen. I think everybody must have seen kindergarten, schools, colleges, workplaces getting closed down, and everything was in a chaotic situation, and work life balance was just getting nowhere, and everybody was in a real chaos. Uh, Not only that, and I think with that, a lot of people feared that what is going to happen with what the work which they were doing. It was about the job security. It was about the way they were working. It was about the health situation of. I mean, when I came to the city where I live in Jaipur, it was about that how many cases are there in the city. But then things started getting closer. Then I heard that a lot of people are getting affected with COVID within the building, and it was in the building, then it was in the house, and everywhere you could see that, I mean, there is an anxiety, and with that anxiety, I think we were losing. We all had problems of mm, motivation to keep working, motivation within oneself, motivation within the team and within the organization, to make sure that we all work for the cause for which we have been working, and that required a lot of motivation, a lot of things. So as institution, I would like to highlight a few things which we have been doing, which we have done. uh, can we go to the next slide? A lot of things have already been mentioned by the previous uh, speakers, and I'll not repeat those. We'll just try to focus on something which we have been doing. I think to one of the things which we immediately did was an additional insurance. If anybody required an additional insurance, to make sure that they are covered for their health, for their medical insurance. Second is immediately working from home with all the equipment required, computer, internet, and for example, I didn't had any space for myself working from home. I mean, I didn't had any room which I could have thought of as. So I think at institutional level, we supported people so that they can have table, chairs, basic equipment, internet, with which they can work and be comfortable working. A lot of scheduled trips were cancelled, and I think all these things are going to get into new normal. We all will be working from home, as more and more we will need more insurance. We will have to have new norm for traveling. We will have to have new partnerships, as German has said. I think partnerships are going to be key, and localization is going to increase as we move forward. The way in which humanitarian world is working is going to change in a drastic manner. Uh, Second is, as I mentioned, I mean, there was anxiety within with everybody. People were getting affected. The families were getting affected. There was an anxiety in on how things will happen, and that required uh, you know lot of discussions, regular discussions on a regular basis. That also required trainings on personal development, on leadership, on how we should be working, how we should be leading our own teams in such times, uh, and a work-life balance, and also making sure that we make sure that we ensure work-life balance. I mean, we living in Asia, a lot of times have different. So if you have to work with London, I mean, you start late. If you have to work with the ASEAN, I mean, you work early, and if you have to work with the US, then you have to work at night. So or very early morning. So I think these changes have also earlier, because you were working from everybody was working from the office. Most of the times we stick to the times, but now with this change that had also come, that work life balance had got disturbed, and everybody needed some kind of consolation and one to one discussion, personal trainings, ensuring availability of support from specialist doctors was very much important, so that people uh, keep moving on. Thank you. And can we go to the next slide, please? There were a lot of mitigation measures, as I think everybody must have taken. First of all, following country and WHO guidelines, and these guidelines are going to, even if, and I think if we look at the speculations, next year things are going to get normal, and but that is going to be new normal, where we will have more and more guidelines on our travels, on how do we work even within our offices. So maybe half of the time from the office and half of the time from home, or a lot of people might will have to work full time from home. and travel, the way in which we travel is also going to change. It is not going to be the same as we used to do. It is going to be much and much lesser. uh, yes, protective gears and are going to be important. The group activities are going to be much lesser, uh, and remote monitoring is going to come up in a big manner. We we may have seen, and I can give you many examples of how uh, evaluations are conducted virtually. We are talking about video chat interviews, reliance on local resources for conducting field work for evaluations, and definitely, I think the way in which we are working, as Dr. Heng said, localization, local leadership is going to take a bigger role in the humanitarian work in coming times. We will see. Thank you. Thank. Thank you, Kea. Over to you.
Yeah, thanks very much, Deepak, and highlighting the realities of the operational challenges we've had to adapt to. And like I say, the travel restrictions, the insurance, the protection that we're going to have to take forward and change internal policies. That concludes, thank you for us today, the panelists. But I want to again hand back before we open up to questions to Adelina after these additional presentations for any further reflections. And, you know, like we said, start at the beginning, thinking about this, moving forward, the priorities.
Moving forward, the priorities.
Over to you, Adelina.
Thank you very much.
Over to you, Adelina.
Thank you very much, Kea. I agree to everything that Dr. Heng and Mr. Deepak have said on the importance of duty of care, psychosocial support, as well as the fact that in the future, through the lens or through the lens of Mr. Deepak, that the future will be different in terms of the way of doing things. If you are you are the same as me in terms of generation or age. It was really different the time when there was no email. Then when the email got introduced to the workforce, then things changed, right, more rapidly. And I think COVID-19 will also do the same wonder that things will be more rapidly, and more things will be done online or virtually. So that we will have to adjust accordingly. I guess a few things that I would like to offer. One would be we need to start thinking and preparing internally first as an organization, as well as an individual. As an organization, for example, what we have been doing in AHA Center is to put our thoughts into a strategic direction paper that we presented to the governing board, our governing board that consists of the heads of the National Disaster Management Organization of the 10 ASEAN countries. What we put there in the strategic direction paper of the governing board is what we think would be the next priority for the next 5 years, how we redefine the future, what should be our priorities, how we move forward, and also how we should regard issues such as sustainability, resources, localization also included in our paper, and also how we should deal with the additional tasks like responding in conflict areas, or providing support to the health sector when there is a pandemic. So I guess all of us internally within our respective organization will have to do that. If you have questions, it would be good to put that all into the paper and consult either your governing board, or your vice president or your president on the direction, for the next 5 years, reflecting on the changes and the transformation that you have to undergo, and also taking into account the fact that post-conflict will take not only 1 year but a few years. So we have to reflect on that and share this to your governing board, to your superiors, so that you are working on the same page. For us, it's important, to do that, because we are working for the 10 governments, and we need to make sure that what we are going to do is actually in consonant with the 10 governments in ASEAN. And then we also need to communicate that internally within our organization. As a leader, right, the number one in AHA Center, we need to communicate not only externally but also internally, so that they can also copy and help us in particular on transforming our organization through uncertainty. Number two, I don't know about you guys, but the past 1 year is more tiring than any other years. Even more tiring than the years when I travel a lot. And I think that is also due to the fact that it has been a hell of the year. So many challenges, so many uncertainties, right? While we have also to respond to many things, and also reflect and transform and adapt at the same time, and bring it from home. So I think this duty of care, psychosocial support, needs to be prioritized, because if we are not healthy mentally and physically, how can we actually provide support to others? We are humanitarian workers, we are disaster managers, and as a leader, I think we need to be paying more attention, to those inside the organization, and also to ourselves. I'm really grateful to the short message sent by Dr. Heng to me a week ago. Thank you very much. And the coffee package sent by Vanda. That actually reflect, the kind of support that you have from your peers and your friends. And once in a while, even a leader of the organization would benefit from that. I guess only those two that I would like to offer. That is, use the change of the year to really reflect and prepare ourselves internally and externally with our superiors on what we're going to do in the next 5 years or 10 years in view of the post-COVID. And then number two, take care of ourselves. Over to you, Kea.
Thanks, Adelina. They're both excellent messages to end on, and institutionalizing the adaptations we've made this year. We don't have much time left, so we want to throw it open to questions, and we already have two great ones. I'm going to start from the bottom and work up. We have a question, I think it was to Deepak, more if you could elaborate about the virtual evaluations and that process.
Thank you, Kea. We have just experimented a virtual evaluation for our Sulawesi recovery project in Indonesia, where we have appointed the experts on the subject experts, different subject experts for evaluating. So there are 4 external evaluators who are doing the virtual evaluation, and we have hired a local agency in Indonesia so that they provide us with the field insights. So all the field insights are taken with the video, and our evaluators were present when the interviews were taken. So that's how, and the questions were given very clearly by the evaluators on what to ask and how to ask. Yeah, so this is what is going on right now. Once the report will be there, I think we'll have more learnings. Thank you, and over to you, Kea.
Thanks very much, Deepa. We have another question now, I think, from Kunal, and I think it's to Heng, but maybe Dr. Heng, but more generally about, the mention of GBV cases increasing and wanting to know, we recognize this, but if the actions that we're taking, if we have a sense of whether they're helping reduce or prevent cases.
Okay. Sorry, the question is, what can we do to prevent cases? Am I right?
Or if we're seeing, the cases, are they changed? Is that having an impact?
Cases, yeah. Okay. I think the most important thing that we all have to realize, and this message actually had, much has been tried, but hasn't really got out. Let's just get back to basics. COVID is spread by human beings, by close contact. If you stop that close contact, slowly the disease goes down. And this is the message that we have to put out, and we have been putting it out. Unfortunately, in Malaysia, and I think it's probably all over the place, unfortunately, in spite of all this, maybe it is not clear enough, maybe it's not good enough, maybe it hasn't got into their brains yet. So they will wear a mask outside, they will wash the moment they go back to the villages, right, the mask and everything comes back and the community gets back together. Or, when they go for a wedding or something like that, it doesn't have to be 20, 30 people. All it needs is more than 10 people or even 10 people. And the moment you forget about social distancing, the moment you don't wear your mask, the moment you don't wash your hands, it spreads. And for everyone that has spread, every particular person who has got it, maybe another, he will probably spread it to another 2 or 3. That is a sad thing. And we see this all the time. We put it out in our message, but obviously our message, our TV programs or whatever it is not good enough, and it is not clear enough. Sorry, but that's the only thing I can say. Thank you.
Thanks, Dr. Heng. Yes, the importance of messaging and effective messaging. We have a few more minutes. Do we have any other questions or responses to either Kunal's question here about the GBV prevention and actions? Or I guess a question maybe, so we've got someone with their hand up. Thunder, yes, if you'd like to jump in.
Yes, thank you, okay, and thanks everyone for the interesting sharing. Just basically, I put on the chat box just to share that basically in Plan International, we have a number of interventions towards prevention of GBV. And then this also, again, promoting the collaboration with other agencies. In Cambodia, we work with Child Headline, and also at the regional level, we release a kind of like press statement to really emphasize to the ASEAN leader as well as SARC to really emphasize on the importance of child protection. And together with Save the Children, we also release a publication called Because We Matter to really emphasize that the protection issue towards girls, women, and then to prevent and mitigate about gender-based violence is really important in terms of COVID-19 response and facing the other emergency that we have in the region. So it's become very, very important to consider about this issue. Thanks, Kea. Kea, are you still there? Kea, you are on mute. I think perhaps Kea have some technical issue. Yes, Mbak Adelina, if you would like to jump in, Mbak, to add on protection, please.
Okay, thank you very much, Vanda. I would like to convey good news from the ASEAN family. First of all, the new ATMEL work program for 2020-21, 2025 has been endorsed by the ASEAN Committee on Disaster Management this few weeks ago. As you know, the development has been led by the ASEAN Secretary together with the ECDM family as well as the AHA Center. And APG has been consulted throughout the process, and I'm glad to inform you that you'll be part of the implementation as well, as there are some activities related to civil society as well as APG. So please look at our new ATMEL work program. Second, and this is related to protection. Just yesterday, there was a new technical working group on protection under our ACDM family. Just met yesterday, And this is actually a new initiative under the ATME Work Program as part of the commitment to further socialize, but also institutionalize the issues of protection, including for those who are most vulnerable and children as well as women into the disaster response mechanism. And AHA Center has been also supporting this idea. And in fact, we are looking into how the protection guidelines that have been developed in ASEAN together with the social welfare sector will be further streamlined into the disaster response mechanism. But the fact that there is now a dedicated sub-working group under the ECDM family looking into the ideas of protection, I think something that shall be capitalized further by those who are interested in this issue. Over to you.
Thanks, Adelina, for that really for that interesting thing about the future opportunities there around the protection discussion. We're just in, I realize we're already over. So to do a very quick wrap up from this, from all the excellent presentations that we've had and discussions, experiences being shared, I guess maybe to leave a couple of reoccurring themes that came across in today's discussion about understanding risk. And I think, as Adelina had said earlier, understanding the layers of risk to help us with the anticipation and being better prepared. And something that Jermaine and a lot of others came with is obviously building and doing that horizon scanning on what is already existing, understanding the social capital of local actors, understanding the complementarity of the different partners and that whole of society approach, and the importance of coordinating that, I think, is something that came up repeatedly through the different discussions, and the importance of duty of care and recognizing that and having to look at how we do concretely adapt our ways in terms of moving forward, and recognizing the ecosystem that this is going to require that development humanitarian and looking at across and not being siloed and changing the way our approaches are moving forward in the future. So I think that was a very, very brief summary of some of the messages that came out. I don't know if any of the panelists want to add anything that anything that I missed there. Otherwise, we'll wrap it up there. It doesn't look so. So I just again want to say thank you very much to all the presenters today, and for everyone to take the time to join this discussion, and hope that this discussion we continue to collaborate on and look at the way forward and how we integrate this into our practices. Thanks, everyone. Stay safe.
Thank you.
Thank you, everyone.
Bye.
Bye, everyone.
Thank you. Bye-bye.